This really started about 4 years ago, and I think what really contributed to it was 14 years ago I had a very bad sinus infection. I went to a ear, nose, and throat specialist, and he put me on a very strong antibiotic, and after 10 days it wasn't working, and he kept me on the same antibiotic for 30 days straight before he finally gave up on it. And since it was the strongest one he was going to use, he said the only thing he can do next would do a surgery to flush whatever it was out. So he put me into a surgery, which it's pretty nasty surgery. He had this big, huge needle, and they put some kind of numbing agent in your nose, and they popped this thing through your bone. And when he did that, I passed out. The next thing I know, I'm having cold, face cloths on my face. and then he proceeded with the procedure after that, and he flushed all this stuff out. And the funny thing is, the infection probably wasn't a bacterial infection to begin with. It's probably a fungal, and the antibiotics was just making it worse. And that's why the only thing he could do is do the saline solution to finally flush it out, and that cleared it. And that's when I started getting all the problems with my gut. It was getting anal itching, and it would come and go, and after a few years it just wouldn't go anymore, and it started getting progressively worse. And looking back, I know that my bodily defenses was pretty low because I was getting stressed out about one of my sons. He's not doing too good in school. I was stressing out about that. I was stressing out about work, and that just contributed. All those things together just did me in. I just recalled that there's another instance. I went to a doctor, and one of my eyes was kind of, getting a lot of mucus in it. And he looks in and said, "Oh, you got this." I forget what he called it. He says, "Mayo in the eye" or something. He called it, and he gives me this real strong antibiotic. And then a week later, I went to an ophthalmologist, and he says, "What did he give you?" He goes, "He gave you that?" He said, "That's a really strong antibiotic. Did you take them?" He goes, "Yeah." He said, "Don't take them anymore. It's basically antibiotic abuse." He says it's not even bacterial, and he was incredulous. He says, "He gave you that?" He said, "It doesn't look like bacteria to me." It's just another instance of the doctors just prescribing antibiotics without knowing what they're doing.